Hello and welcome to our podcast,
Beyond the Bump Unplugged.
We are your hosts. My name is Ashley,
And I am Brooklyn.
and we are both doulas in the Grand Rapids area who started a podcast to talk all things motherhood.
Yes. And motherhood, we will talk about.
Yes.
The very beginning, where it all begins, labor and delivery.
That is our topic for today, labor and delivery, and we're going to tell our personal labor stories.
Yep.
And kind of tie in how a birth plan is a good thing to have. And it's also good to know that the birth plan isn't always going to go as planned.
Yes.
So I'll begin. I have the oldest out of us.
And right now, if you don't like birth or labor stories, now's the time to
Peace
leave.
out.
But if you like it and you're weird like us, stay and maybe you can learn a thing or two.
Yeah. So I had my first daughter in 2022. I had the plan of I'm totally going to do this naturally. It's going to be great. But we'll see because I'm a baby. So if I need an epidural, I need an epidural. I was nearing the end of my pregnancy and I was like, I'm done. I don't want to do this anymore. It's summer. I have pork sausage toes because they were so swollen. And my ankles were cankles and I was done. So I planned an induction at my 40-week mark. And at my 39-week appointment, I got a membrane sweep. If you don't know what that is, we'll talk about that.
Yeah.
It worked. I went into labor the next day. My husband and I, go husband, he was curb walking with me every single night, trying to get this flipping baby out. And we went curb walking. I was really crabby and I decided I wanted to go to bed. I woke up literally 5 minutes later, went to the bathroom, and my water broke. And I was like, oh my gosh, my water broke.
At that moment, did you know that it was your water, or did you have any is this did I just pee myself, or did you just knew?
I knew, and I didn't think I would know like I did.
Yeah.
Because everyone's like, oh, it's not like on movies. It just is kind of a trickle. No. Mine was on movies. It wasn't a trickle. Luckily, I was going to the bathroom, so I didn't make a mess. But I knew, and I was calling for my husband, and he's passed out cold within 5 minutes. I don't know how they do that, but
we
it
love
happened.
Pete.
And I'm like, oh my gosh, my water broke. So we rush and we get in the car and get there and nothing's happening. They were like, okay, well, it was your water, so we're going to keep you. And I wasn't having any contractions. I was dilated to a 4, so that was cool. But literally nothing was happening. Nothing was happening. So I ended up having to have Pitocin. Lucky me. And I found out very quickly I'm very sensitive to Pitocin. So once I had a contraction that literally wouldn't stop, I was like, round it up. I need the epidural and I need it now. And, I tried laboring on the back of the toilet because I saw some picture one day of somebody doing that. And I was like, I don't know, maybe that'll feel better. For me, it didn't, but for a lot of people, it does. I was in so much pain. I couldn't even think to do anything different.
I feel like in that moment, you don't care.
Yeah.
All of the plans that you had in your head, all the strategies
Yeah.
that were planned,
which honestly
are all basically out the door.
Yeah. And that's where a birth doula, I think, would have been helpful for
Yes.
me because they have not a labor mind going on. And they're like, hey, let's try this or let's do this. And I was just straight I need the epidural. So
and your husband's just trying to support you and your choices, and he's watching you in pain. So he's like, I don't care, give her whatever.
Right.
Just trying to get you through it. So definitely, I feel like a birth doula. I didn't have one, but had I known about them and what could have been, I probably would have looked into one.
Yeah, same. Especially in those moments where, they're just helpful. They're a mind that's not in pain that can help you with different positions and stuff.
For sure.
I got the epidural and I was very sassy with the doctor because he was taking a lifetime to place it.
Ashley being sassy? What?
He kept telling me, I need you to bend forward. And I said, I have a bowling ball on my stomach, sir. I can only bend forward so far. And my husband's sitting in there like, oh my gosh, oh my gosh. She's being mean to the doctor. But after the epidural, I felt great. I felt on top of the world. I was like, labor.
Yeah.
What? And then my doctor came in like 10 minutes later and she was like, oh, like, here comes baby. She's coming. Like, you're ready to push. And I pushed her out in 3 minutes.
What was going through your head when she said?
I was like, what? Because I couldn't feel anything. Like, I had the epidural that numbed me completely.
So, because I didn't have an epidural, how do you know how to push or if you don't have any sensation?
She told me to push like I was pooping. And so I pushed like I was pooping. And spoiler alert, everybody poops during birth. You're going to poop.
Yep. And it's going to be okay.
Yeah.
And even if you smell it, it's all going to be okay. The shitty situation will be cleaned up quickly and you will forget it because a baby is literally coming out of you.
You don't even think about it in the moment. I did think about it like right after though. And I asked the nurse, I was like, did I poop? And she was like, no. And I was like, you can tell me it's okay. And she was like, okay, yeah, you pooped.
I remember after your second baby, after we both had our second babies at one of the play cafes, we were talking about our birth stories because we're weirdos. And
we did.
And we both were just like really quiet about it. We're like, we definitely both.
Yeah.
It was just so funny because
it's going to happen.
Yeah.
It's going to happen.
People don't talk about it enough though.
No,
they just
I feel
act like it's
women...
just this beautiful, wonderful thing, but
yeah, and I feel like we were like embarrassed, like, oh my gosh, like I hope I don't poop during labor. Like if there's anything in your colon, it's coming out.
It's coming out.
So just ride it off. They see poop every day. It's gonna be fine.
Poop is nothing.
My husband might disagree with the smell, but we'll talk about that later. But yeah, I pushed her out very quickly and I had a beautiful little girl. We didn't know she was a girl until she was born. We waited to find out.
How did you go so long without knowing?
I don't know. And I thought she was a boy the whole time. And my husband was like, okay. Right before I started pushing, he was like, boy or girl. And I was all of a sudden like, it's a girl.
Mm-hmm.
And it was a girl. And I was like, I don't know. That was weird. But, but yeah, we had our little girl. And luckily I had the epidural because I had a manual placenta removal, which we'll talk about in another episode.
Yeah.
But from what I have heard, they're very painful.
Mm-hmm.
I did not experience pain because team epidural.
Yeah.
So, but yeah, my birth, honestly, it didn't go poorly. So there's not much I can complain about, but not going to plan. But, yeah, I was flexible in getting the epidural when I knew I needed it. And honestly, it's probably what my body needed to relax a little bit too.
Mm-hmm.
That's how my first one came around. And really the only complication with there was the retained placenta. So, which was, we'll talk about that in another episode.
Yes. So then along came my first baby. The whole thing was crazy. That's your first baby is, I feel like you just don't know what you're really planning or whatnot. But
you don't know what to expect until you're there.
No. I kind of went in with this idea in my head that because I'm terrified of needles. Like, I do not like needles.
But she's not terrified of that pain. Superwoman.
I'm terrified of needles, and stupid me Googled a video of an epidural probably like a week before I was induced.
Why did you do that?
Because I'm crazy and I didn't know what I was getting myself into.
Actually, it's probably fair. I mean, you were then prepared of what it would be like.
But anyways, I watched a video and I said, no, hell no. That's not going in my back. Just the thought of arching freaks me out. Okay?
Arching
even right
is
now,
the hard part.
I'm like, please. That freaks me out. I was going to see obviously my doctor, but I didn't have the same doctor every time I went.
Mm.
So every time I went, it was a different story. Nothing was wrong with me.
Yeah.
But every single time it was about my weight. And one doctor was telling me that I wasn't eating enough and that I'm anorexic. And Dalton's sitting there and he's like, lady, do you understand? We just went to McDonald's and she just crushed 2 McMuffins. Like, she's not anorexic. But I had lost so much weight during my pregnancy with Houston, which usually you gain weight. One doctor was calling me anorexic, and then the last doctor that I had saw, she said my BMI was too high and she would need to induce me.
Oh, God.
Newsflash, it was Labor Day weekend, so she probably just didn't want to be.
She didn't want a holiday baby.
In the hospital at that point in time. We go in for our induction, and the only time frame they gave us was 11 p.m.
Oh.
Yes, so we had to go to the hospital at 11 p.m.
That's
and
so strange.
right off the bat, they started me off with Cytotec. Nothing was happening. We did 3 rounds of that. Nothing happened.
He was just comfy cozy in there.
But they had decided that I was dilated enough that I wouldn't need the Foley balloon at that time. And so they just broke my water and hoped that would kickstart things, and it did not. And so then they put in that Pitocin and just kept going up and up and up and up with it.
Do you know how far you got up on your Pitocin?
I think it was a 22.
I think the highest they can go is 30.
Yeah. So it was a lot. And every single time they had to go up again, I was like, please no. Please no. I don't know how much more I can take of this. But my biggest thing was I could not lay in that hospital bed. There was not an ounce of me that wanted to be laying down laboring. I had to be walking the halls. Those nurses probably thought I was crazy, but I went at least probably 200 or 300 laps
They were
around
probably
them.
like, thank God she's not just sitting in bed. Because so many people don't want to get up when they're in that kind of pain. And it's better to get up.
Yeah, that's the only way I felt good was walking. Walking and bouncing on my ball. The nurse that I had was very nice, and she let me go in and out of the bathtub, and she let me, she was willing to maneuver my, what are those, belly bands or whatever. Yeah. She was awesome. She was all for it. But after she had left, it was a new nurse, and she's like, no, we're not going in the bathtub because of infection and whatnot. Another great reason why a doula would have been awesome at that point, because I wasn't going to fight back, because I thought a nurse, you just trust your nurses and whatnot. So basically just kept walking. I finally was at the point where I cannot take this anymore. And that's when I knew I was in transition. And so, or at least that's what I thought. I told my doctor that I had to poop. I'm like, I have to go to the bathroom right now. She's like, I don't think you have to go to the bathroom. I'm like, but I really do. And she's like, let me just check you really quick. And sure enough, it was his head and he was ready to come out. I pushed for maybe like 10 minutes. He came flying out and everything was great until it wasn't. And I hemorrhaged pretty badly. They had to put 2 shots in my legs. They had to ramp up the Pitocin, anything to get me to stop. They were pressing on my belly really, really hard. But compared to my second birth, this was nothing, but it was scary in that moment. My mom hemorrhaged with me, so I kind of knew what was going on, but no one was talking about it. So that was really scary, and I'm like, what's going on? While this newborn baby's on my chest, and
there's a ton of doctors and a ton
I'm
of blood.
Okay. And of course I tore, so they had to put a few stitches in, and luckily everything just tamed down on its own and I was okay, but it was scary and I didn't know what was going to happen, and come to find out.
Did stitches hurt more than birth?
Yeah.
That is what I've heard. So many people that I've talked to that didn't have an epidural. I want to
say though, like with Houston's birth, because I wasn't sure what was going to happen and I didn't know what it was going to feel like. Yeah. I feel like that wasn't as bad because I didn't know what to expect. Whereas Gatlin, I'm pretty sure I tore in the same exact spot and that was super painful. I don't think, because they give you a shot and everything beforehand.
Oh, like a lidocaine.
Yeah. I don't know.
I would imagine it's just all painful.
Yeah.
I
But
couldn't
I
do
think
it.
that epidural.
I couldn't do it. I wish I could because
everyone always says, Brooklyn, like, you're so amazing for not getting in the epidural. I'm like, no, but you're amazing because you got the epidural, because I can't even sitting right here, arching my back grosses me out.
Meanwhile, I'm like hunched over. I can arch my back.
Just making sure you know how to handle your pain, and
yeah, that's a big
kind of
big
having
thing.
a plan and everything is really helpful, but also a doula would be a lot more helpful.
A doula.
I cannot stress that enough. Having someone who knows what they're talking about and
especially
certified
your
in,
first one,
because there is so many nurses who are going to say you need the epidural and you need this, or a lot of them aren't natural. They want you to get the pain medication because they don't want to see you miserable.
Yeah. Honestly, if I could do it without the epidural, I would, because it's not fun not being able to get up when you're done. Where like I didn't have like much of the epidural with my first, so like it wore off pretty quick. But with my second, I was like bedridden for a while. It was a little alarming. I was like, I still can't feel my legs. I would love to say if I have another baby, I'm going to try to do it natural, and maybe I will. I don't know if I can do it. But
you can do anything you put your mind to.
Props to all the moms I can. I will be there to support you through the pain. And I'll also be there to support you if you decide that this is not the pain you want to endure and you want an epidural.
Moral of the story is we are very pro whatever you want.
Yeah, whatever the mom wants. Yeah. Whatever is going to make the mom happy and comfortable and enjoy the birth experience as much as they can.
And there's no shame behind it. Yeah. There's no shame if you get the epidural. There's no shame if you want the gas or whatever it may be. I think just having someone to know your options, or even yourself knowing the options in that moment, is crucial.
Yeah. And hopefully even your doctor talks to you about the different pain managements, like, and you're one of how many appointments that you have that they go over what you can do as far as medications and pain management and stuff like that. So hopefully they go over that. And then we had another.
Yeah. Round 2.
Yeah. The sets are both a month apart from each other. And so I found out I was pregnant with my second, and obviously we told Brooklyn. And not long after, she was like, same. I'm pregnant too.
Yeah.
And we were like, oh, this actually works out perfectly.
It was so funny because when you were telling me that you were pregnant, I was actually pregnant and I had no idea.
Yeah. Yeah, because we waited not too long to tell you, but
no.
We had so we found out we were pregnant, and then I had a very long pregnancy with my second due to a doctor saying I possibly had something, placenta accreta. So actually, we'll just back up. We'll tell the story. Had an ultrasound at 9 weeks because my anxiety was like through the roof, and they were like, let's do an ultrasound. We can check everything, make sure it's fine. I had a cyst on my placenta, which, looking back, I don't think was a big deal, but it felt like a big deal at the time. So then I had another ultrasound in 4 weeks, and the cyst went away, but they said, you could have placenta accreta because you had retained placenta with your last, and sometimes it shows up as a cyst, and, this could mean
What is placenta accreta?
It is when your placenta grows into your uterus where, like, it wouldn't detach.
Okay.
On its own, like your placenta usually does after you deliver. And sometimes, like, in really extreme severe, cases, it's severe. And then in extreme cases, it can even grow like outside of your uterus and like attach to other organs.
Okay. Wow.
So it can be a big deal. I mean, I think it's a big deal in like the least severe case.
Yep.
This doctor is like, well, you know, we'll see how it goes. We'll keep an eye on it. But, there's a chance you'll have to deliver at 34 weeks. You'll have to have a C-section. Like, good chance you'll have a, like, full hysterectomy during it.
Mm-hmm.
And, we'll have blood on the floor waiting for you if you hemorrhage. And I'm like, what?
All of that at one appointment.
What? And
Mm-hmm.
thank God my husband was there with me because, I mean, I think she was saying, I was just like, am I going to die?
Yeah.
Like,
That's all
what
that.
do you mean?
Yeah.
And then my husband's like, how is she supposed to leave this appointment okay? And the doctor was like, oh, well, it might not be anything. Well, what?
Yeah.
I mean, she even said, and it's just, I think it's too early to think about terminating because, like,
Mm-hmm.
it could be nothing. And we were like, we never thought about that. That wasn't a thought that even crossed our mind.
Mm-hmm.
Like, what? Every doctor's appointment, I had an ultrasound to check on this placenta accreta.
Mm-hmm.
And every doctor's appointment, it was like, I had things called placenta lakes, which are pretty common in pregnancies.
Yeah.
And they don't worry about them unless they're a certain size. And mine were not the size that they were looking for, but because they were there, they wanted to keep an eye on them because, like, maybe it could turn into placenta accreta.
Yeah.
So every appointment, we were left with no answers except things look fine for now. We'll do another ultrasound.
I remember you came home from one of your appointments, and I just kind of knew something was off.
Yeah, I'm not very good about hiding
and I'm
things.
like, Ashley, like, are you okay? And you just, like, started bawling. And
Yeah.
I started bawling with you, and I didn't even know what was going on, really, because I just can't imagine life without sweet little Peter.
I know.
Because
So she gave me run for the money in the womb. And here she is today.
We love her.
Yeah. But I had all these appointments, and every time it was fine, but we're going to keep an eye on it. And then they were like, well, there's no reason for you to deliver early. Like, you can go on your own, whatever. And
were you at all worried that if you, like, once they kind of dropped the ball of not having to deliver early, did anything cross your mind, like, maybe we should, or did you feel a lot better about it?
I felt like that doctor put her foot in her mouth a little bit for even saying that in the beginning. I mean, obviously, I was trying to think logically about it, and every doctor that I talked to was like, no, I don't think that's what we're looking at here. But of course, in the back of my head, there was always a, well, what if it is there? And these, like, what did she see?
Yeah.
That they aren't seeing a little bit. But I also didn't want to deliver at 34 weeks if I didn't have to. At 37 weeks and 6 days, I drove my happy butt to work in the morning. And I remember I texted Brooklyn and I was like, I'm having some contractions, but, like, it's probably nothing, but just, like, so you know.
Yeah.
And I texted my husband the same thing, and they're both like, okay, let us know, like, if anything happens. And then, like, I start tracking them at work, and I'm like, well, these are kind of close together. Yeah. But they're not, like, they're still, like, fine. And my boss is like, I think you should go home. And I'm like, no, I'm good.
You kept telling me, you're like, you're like, I don't know that I'm in labor. I'm like, but I think you are. Because
I don't know what I was thinking.
If you're texting me about it, I think you know.
I think I was just like, there's no way.
Yeah.
That this is...
like in denial almost.
Yeah. And so I drove. Well, I texted my husband and I was like, I'm just going to go to the hospital and get checked. Like, it's probably nothing. Don't leave work. And then I was like 5 minutes from the hospital and I was like, holy shit. I can't do this. Like, oh my God, I'm in so much pain. And so I called him again and I was like, just kidding. I'm pretty sure I'm big time in labor. You should leave work and come to the hospital right now. I didn't have a hospital bag packed. I was so unprepared. And God bless my husband.
He drove Dalton's car.
Yeah.
He didn't have, because he had the trailer hooked up or something, right?
His work trailer.
So
he couldn't get in a parking garage with it.
so he just told Dalton, like, I gotta go.
Yeah, I gotta go. And he comes home, stops at our house first, gets me clothes that I wore before I had my first baby. They were really small. And I was like, thank you.
He tried so hard.
Yeah. So I go to triage and I get checked and I'm dilated to a 7. So I was
That
like,
is
okay,
crazy.
I'm definitely, and the girl's like, nope, you're not crazy. You are certainly in labor. And my husband got there like an hour later,
Mm-hmm.
and 3 hours after that, I had my second daughter. It was honestly, when the doctors said, well, she had meconium when they ended up breaking my water. My water didn't break on its own.
Mm-hmm.
She had meconium, so when it was time to push, there was like 10, 15 doctors and nurses in the room. I mean, we had a full house. We had a birthday party. And they were like, okay, it's time to push. And I remember my husband and I just like said a prayer because we weren't sure when she came out, if my placenta was going to come out, if it was attached to my uterus, if I was going to get rushed to the OR, or like what was going to
Yeah.
happen. And I pushed her out in one push. Again, I pooped. And my husband's face was like white. And I was like, what's wrong? And he said it was the smell. It smelled really bad. And I knew it smelled really bad. I wasn't stupid. I could smell it myself. But yeah, we had our little painting girl, and then my husband, my little advocate, he was my birth doula for my second, and he's like, excuse me, can we get an ultrasound machine in? We need to make sure that her placenta is fully out. And they were like, sure, and they did an ultrasound, and sure enough, actually, I did have a piece of retained placenta in there. So
Go Pete.
good on my husband for being an advocate for me, because who knows if it would have come out on its own or if I would have been back in the hospital
Mm-hmm.
again.
After you had Peyton and you went to your 6 weeks checkup, did they mention at all like you'd have to worry about placenta problems for a third baby or no?
My doctor said absolutely nothing about the placenta thing.
Mm.
She did not even recognize
Little
it.
treat.
She literally said, "You did a great job." And I said, "Thanks. I never want to see you again."
Yeah.
You caused me so much stress throughout
Yeah.
this whole process
Mm-hmm.
that was unnecessary. I mean, I guess good she was being like hyper vigilant or whatever, but
Maybe in a better, proper way
yeah.
would have came across a little better.
Yeah.
Especially, I mean, if you know your patient already has anxiety about their pregnancy, adding that to
Yeah.
the mix probably wasn't
It could
the
have
best.
maybe been brought up differently.
Yeah, for sure.
But
I agree.
either way, we have her daughter. She's great. She's a lot.
You had the dream labor. Like,
Yeah, it was really textbook. And honestly, I did have an epidural, by the way. And I was like, just give me the epidural now, because
yeah.
I know I'm going to want it, because I don't know what the heck is going to happen when this baby comes out. And I want to make sure I'm numb.
Mm-hmm.
And I was numb for a very long time. And then a month and a half later.
Yes, a month and a half later, Gatlin came along.
Yes.
Everything was great up until what, 36 weeks?
Yeah.
And they told me that he was no longer head down and that I should probably be preparing for a C-section.
Did they offer to do a flip for you?
They did. They did. They offered to do the ECV, which I did a lot of research and I reached out to a lot of people, and it was really nothing I wanted to do, but I scheduled it anyways because I also didn't want a C-section.
Yeah.
I went to the chiropractor religiously, and I did the spinning babies on YouTube multiple times. And luckily, the week after, I found out that he was back to head down position, and I was like, please stay that way.
Did you think he flipped?
No.
You had no idea?
No. I went in on that appointment and I was crying beforehand, and I cried when they told me he was head down again. What a blessing. But then they hooked me up to the monitors to do the stress test or whatever, non-stress test.
I so am curious why some doctors do stress tests and some don't.
I haven't.
I've never had a stress test.
Never?
Mm-mm.
I
No.
did one with Corwell, and then I did one with the midwives. Actually, I did multiple with the midwives.
Yeah, I've never had a stress test. And almost everybody that I talk to, like, they have stress tests.
That's
And
it's
I'm like-
crazy that you...
And when I asked about it one time, I was like, am I supposed to be having stress tests? And they were like, no, there's no reason for you to. But like everyone else I talked to
That
were
is
like,
so
there was
weird.
really no reason for me to have one either.
Yeah.
So I don't know.
That's
I don't know
really,
why some
really
do and some
weird.
don't.
They had me do the stress test thing, and they couldn't find his heartbeat multiple times, or the heartbeat was dropping and this and that. And so I just stay there multiple times, at least for 2 to 3 hours, until they could get good readings.
Which
And
is
then towards the
stressful.
end of it, I was at 40 weeks, and go back a little bit. We actually had no idea when we conceived Gatlin, because he was very much so a surprise baby, a very good surprise baby. We didn't know if we were actually 40 weeks, 41 or 42, which is
Yeah.
terrifying because you don't know what you're getting into.
Yeah.
My last midwife suggested that I just basically sign up for an induction, and that they would be calling me later in the day. And she said we can try multiple things before then to see if we can
Oh,
get you to go in naturally. I was like, okay. And so I did that. Again, another night induction. We had to go in at 1 a.m.
1 a.m.
Yeah.
Sheesh.
Yeah. Before that, they had me do a Foley balloon in the office, and then they sent me home.
Was that painful?
It was extremely painful.
I've heard that they're painful.
They are. They're very painful. Not so much once they're in, or at least I didn't think so, but it's the putting them in is
Yeah.
very painful. And then she gave me castor oil and said, drink that, and we should be able to get this ball rolling. And I'm like, no, I will not be drinking castor oil. I mean, good job for anyone who does castor oil.
Yeah.
But it's not for me. I already knew I was going to poop on the table. I did not want diarrhea on the table, okay? The Foley balloon came out about 12 hours after it was placed, which is, that's what it's supposed to do, dilate you to a 4 and hopefully get the ball rolling.
So were you at a 4 when you went in?
Mm-hmm.
Oh.
But that was, I mean, I was stuck at a 4 forever. It felt like.
Yeah.
I went in and they did, they didn't do the, I want to say they didn't do the cytotech.
Probably not if you were already at a 4.
Yeah. So they went right to breaking my water, and nothing was happening.
Did
Nothing.
it hurt when they broke your water?
I don't think so.
No.
I don't think it hurts.
I've heard mixed reviews on that.
I think it's uncomfortable, but it's not anything like a Foley balloon being placed or anything like that. They broke my water, and I kind of did the same thing that I did with my first. I just walked a shit ton. I finally was starting to get contractions, but they weren't to the point where it was like doing anything for me. Like I wasn't dilating at all or anything. So they decided to up my Pitocin.
Yay.
Yay. And I think I got up to a 15, and it finally sped things up a lot. I pushed for maybe 5 minutes, and just his head came out. And in that moment, I knew something was wrong, because I had heard from other nurse friends of mine about shoulder dystocia, and I knew as soon as his head was out and nothing else was coming out, like with my first, that it was shoulder dystocia. And they have, I believe, 2 minutes.
I don't know if it's even 2 minutes. I don't know the exact number.
I think they have about two minutes.
It's not a long time.
Yeah, to get them out. Otherwise, they have to either manually, like, break their collarbone to get them out, or push them back in and do an emergency C-section, which is terrifying. But my doctor was amazing, and she was able to manually take him out and help him, guide him out without breaking his collarbone or anything like that.
Was she like,
elbow deep?
Her whole elbow deep?
Elbow deep.
Yeah.
While your baby's head is coming out of you.
The maneuver that's called. They do.
I'm the wrong girl to ask. But anyways, she did that, and that hurt like hell.
Yeah, I bet, especially with no epidural.
Yeah. Because again, I'm scared of needles, and I probably should have gotten an epidural, but
well,
anything is better than that damn needle and arching my back.
A lot of things would have been different if you would have known that was going to happen.
He came out, and I also hemorrhaged again, but not quite as bad as with Houston. But he came out not breathing or crying or anything. He was very much so blue. So I didn't get the golden hour. They ripped him right off of me. and they started working on him and putting him on machines and basically giving him CPR, etc. It was really scary for a little bit. I kept
Yeah.
screaming to Dalton because my mom was in the room, so I told Dalton to go be with him, and I was screaming at Dalton, "Is he okay? Is he okay? Like, tell me he's okay." And I was crying, bawling while they're trying to put stitches in me and get me to stop bleeding. And at
What
that
was your
moment,
mom doing?
she was freaking out and crying. She's
Yeah.
like holding my hands, was just everything. It was so crazy. The room was filled with different nurses from the NICU and
Yeah.
etc. So for probably 2 hours of his life was the scariest 2 hours of my life.
Yeah, that is very scary. I can't even like imagine.
Yeah, it was really scary. And my midwife was awesome, and everyone in that room was awesome, and got everything back to normal. And I was able to basically nurse him right away after he came back to us, basically. And our breastfeeding journey since then has been amazing.
Yeah.
He had to have a hip because they were worried about his hips.
Yeah. Probably because he was breech. I think breech babies.
Yes. Yep. Because he was breech, like, and then just a week, but they still were concerned about it.
Did they do like an ultrasound of his hips?
Yeah.
Yeah.
Yep. So we did that, and then they told me basically if we have another baby, that we'll probably have better luck having a C-section. So that's kind of where we're at with that.
Yeah.
He has been the biggest blessing and keeps our life so happy and fun. And he is just the funniest baby. He loves vacuums.
Yeah.
He loves him some vacuums.
Just give him a vacuum and he's entertained for a while.
But yeah. Funny. And they're all the best of friends.
All 4 of them. They are best friends, and it's great.
They fight like siblings, and they love each other, and it's great.
Yep. But really, I mean, between the 4 of our birth stories, it really shows, different things that they can do for you and different things you can do, and just really an opener of, a birth plan is a plan and not everything always goes to plan. Hopefully for you it does.
Yeah.
Obviously that's why you make the plan, but just I think it's really important to remember the end game
for sure
with labor and delivery and healthy mom and healthy baby. And sometimes you got to deviate from your plan, and sometimes you're deviating from your plan just because you want to, because you don't even know what to expect until you're in it. And so you're like, okay, well, that was the plan, but I didn't expect this, so we're going to change it up.
Yeah. I definitely think it pays to just be open-minded and not feel any shame for doing whatever you need to do to get through it, and keep your eye on the prize. And
if you say that you're not going to have an epidural, you don't have to tell anybody you got an epidural.
Yeah.
You can just act like you didn't.
Yeah. You don't have to tell.
If you care that much. Yeah. But you shouldn't care that much.
No. If you have, like, everyone just put so much shame on epidurals, and for what reason?
There's like groups of people that are heavily shameful of epidurals, and it's not the ones who are scared of epidurals. I know there's like a handful of people who are actually scared of them, and that's why they don't get them. And but they're like, yeah, but you're not like, you don't care if other people do. I don't know why anybody cares if another person gets an epidural or not, but there are people out there that do for whatever reason. And I don't know why anybody cares what you're doing with your birth.
As long as that baby comes out and you're healthy and the baby's healthy, like nothing else should matter.
Right. And
invest in yourself by researching, hiring a doula if that is in your, like, if your end goal is to just have extra support and someone who knows what's going on. Because
and really a doula is there to support your partner too, because sometimes your partner doesn't know how to support you in that moment because they're like,
some people don't do well with that.
Or they're like, I've never even seen my wife or partner in this kind of pain, so like, what am I supposed to do to help them? We do love hearing all about labor stories, so if you want to come on and talk about if you have a crazy labor story or you just want to tell people about your labor
Yeah.
story, let us know. We could talk other people's labor
Yeah.
stories all day.
All day.
So,
if anything, I hope people or someone took away from all of this that birth plan is great, but to be open-minded and research and
just that it's okay to change your mind.
Yeah.
Stay tuned for episode number 2.
Yeah.
Where we're going to talk about
postpartum,
how to prepare for it, what to expect with postpartum, things to look for during postpartum.
And we have a lot of good things coming.
Yeah, we do. We have people reaching out that want to be on the podcast, which is really exciting because that opens some doors and gives us education that we don't have. So,
okay. Actually, really excited.
Yeah, some
to
of the
have
stuff.
Some people on here that have different ideas and businesses and
I think we're gonna do like a virtual podcast with a company that's not even in Michigan, so that will be cool. We just have to figure out the logistics of that.
Yeah.
Stay tuned for episode number 2. Yeah, stay tuned for episode number 2.